Public Affairs programming on WQPT is brought to you by the Singh Group at Merrill Lynch, serving the wealth management needs of clients in the region for over 25 years.
Better mental health. What are we doing right and what still needs to be done? Plus, is it the beginning of the end for big downtown riverfront concerts in the cities? River Roots Live announced this week it will reformat its concert series from a huge two-stage event in LeClaire Park to several venues throughout downtown Davenport. Is that a trend we'll see more of in the years ahead? But first, the United Way. Mental health advocates and area hospitals released an independent mental health assessment for the Quad Cities. It calls for better strategic planning, better ways to attract funding, and more accountability to improve mental health and substance abuse care in the cities. Is the report a game changer, though? Joining us is Denise Bink, the Chief Operating Officer of the Vera French Community Mental Health Center, and the President of the United Way of the Quad Cities, Scott Crane. Thank you both for joining us. I appreciate it. Scott, tell me about this report. I mean, is it a game changer? How critically important was it to assess what we've got and what we need?
It's a great first step. This is a partnership between the two hospital systems, Genesis and Unity Point, and then the Hubbell Waterman Foundation and United Way. And as we met with other mental health providers in the community, one of the things that was lacking was an understanding of really the services, the level of comprehensive services available in the community. And so we brought a consultant that deals in mental health issues and mental health assessments out of the North Carolina area. We brought them in and they did a comprehensive assessment of our community. And so this is a great starting point for us to address this issue.
Well, Denise, I had put it this way, but you're in the trenches. You're seeing this time in and time out. Did this assessment, did this report, is it at all an eye-opener for you? Because, I mean, you live it every day.
I think the benefit of the report is it really puts it out in the open for the community to understand where the challenges are in our service system. It's things we've known for a while, but not really been able to put any meat to it.
Have we really gotten to the point that mental health isn't like shoved in the corner? It's not in the shadows. It is something that people are more comfortable about talking about and seeking treatment?
Well, that's certainly what we are hoping. We're hoping for greater education and awareness, and we really want people to access services prior to being critical, problems for themselves and the community. And having that greater array of services would definitely benefit our community and the mental health.
Well, in one area, one conclusion was a lack of same-day mental health services. Explain exactly what that is and why there is this lack of help here.
So same-day mental health access service is just what it sounds like. If you are kind of in crisis or needing help immediately, it is very difficult to get in same day unless you're utilizing the ER and inpatient type of care, which is very costly, very expensive. And so really trying to expand capacity throughout the Quad Cities and get people help when they need it is really a big push that comes from this report.
So what is the solution for something like that? Because, I mean, we've heard over the last year and a half about more beds, more inpatient beds. That's not what we're talking about at this point. We're talking about people in crisis and taking care of something not a minute from now, but this very minute.
Correct. That is really serving people where they're at in their community, wrapping services around them so they don't need those higher intensive levels. We can really contain things. And so it's getting out into the community. It's doing a different way of scheduling for providers so that they have the ability to see folks right that day versus having to make appointments several months out.
Well, Scott, it always comes down to dollars and cents. I mean, does this report say that there should be more spending, or does it say that there should be a reallocation of what's already there?
Well, certainly there are opportunities for advocacy and bringing more money to bear. But there's also in the report, I think, a key push towards efficiencies. How can our mental health system work better together, our providers work better together in a more efficient way to make sure that everybody gets help when they need it. And they had specific recommendations, and the consultants have specific expertise in this area on how to make a community mental health systems more effective and more efficient. And we do have a lot of great providers doing great work. We just need a system that's a little bit tighter.
Well, and one of the things is that it actually passes the baton to the United Way, saying that in some ways you should be more of a coordinator, you should almost be the touchstone to get this process going, and also to assess the progress and the successes of what's going.
We certainly have a role. Whether we're the key agency to do this, I'm not convinced yet or sure. We'll be meeting, the next steps for us will be meeting with the mental health centers as well as the partners who help provide this report to look at, we do have some key groups. Quad City Health Initiative exists in the community. They could play a key role in this. The health systems have to be behind it, and I think they will be. And then the mental health centers, both Robert Young and Vera French, play very key roles in making sure we have a coordinated, cohesive approach to mental health.
Well, Denise, Vera French has been so active in this area, obviously, one of the biggest coordinators for the area. But I ask you this with great respect. Is this kind of, does this report somehow say that there's deficiencies in what's being provided? Is it more that you guys should be doing a better job, or that you should be focusing your resources elsewhere?
I think what it's pointing out is some of the fabric of how we think of mental health delivery is changing, and the community as well as the mental health centers need to be more responsive to what that looks like. As Scott said, collaborating, doing more cohesive models of care, really blending together some different pieces, mental health, substance abuse, developmental disabilities that have traditionally been siloed, and really working together as a team to really serve the person no matter what the challenge may be, I think is the focus for the future.
And when you talk about challenges, we're always talking about funding, and we're talking, especially looking at government. And I know that at the state level and the federal level, it's just so fluid right now,
right.
And there's really nothing that you can bank on. So is it difficult to plan the future of mental health services when you don't really have a plan for long-range funding?
Funding is always an issue with any human service, really, and particularly mental health and addictions, but there are still ways to move forward. There are still some solid funding bases. I think what we need to do is work smarter and not harder, and really think of how can we increase efficiencies in the system so that we can serve a greater number of people and serve them better.
Town hall meetings were held, and I just noticed that in the summary, Scott, it repeatedly said a lack of staff, whether in whatever area that was needed. More people, more one-on-one, I guess, attention. That's not easily done because you need trained professionals, and once again, you need money. So, I mean, how does one solve that?
There's a couple things with that. Certainly, that came out of the forum that we had a lot of family members, and family members, when they're in crisis and unable to access services, it becomes a very frustrating situation, and it's easy to say what we need are more people.
Right.
To Denise's point, we need to be more effective and more efficient in how we use the people that we have. The report also stated we need to utilize people at different levels. We don't necessarily need a psychiatrist for every situation, but how do we use the right, appropriately trained person for the right circumstance? So it's a question of coordination. Do we need more providers? Yeah, probably. We do, or we need to use technology better in order to access providers that may not live in our community to provide the services necessary. But we do have we have a lot of good providers in the community. We just need to use them better.
Well, and as we also know, sometimes that people that have certain disabilities might be more of a danger to themselves, perhaps sometimes society as well. And we're talking about the mental health courts, and one of the recommendations to expand that. And I'm not really all that knowledgeable about what the mental health court is right now.
Well, it's designed to take individuals, and Denise might have even more information on it, but it's designed, when you look at the court system, so many of the folks that are incarcerated also have a mental health issue, and incarceration may not be the best solution for taking care of that person and rectifying the issue. A mental health court is kind of that first step, if you will, to help adjudicate and provide treatment for that individual,
almost
rather than just incarceration.
Almost a safety net for the people that have gotten on the wrong side of the law.
Correct.
So what is being provided now, and what would you like to see as far as an expansion in that area?
Well, right now what's being provided, this was kind of their first pilot year, and they've done some wonderful things with some folks that do have severe mental health issues along with involvement in the criminal justice system. And they have taken them and once again really intensively wrapped services around. With those folks, a lot of the social determinants of health come into play. They don't have adequate housing, they don't have adequate education, they lack a job. And so really putting those services in place and helping them get these things in their lives so that they can exit that criminal system is very beneficial. And so we would, of course, like to see that expand.
Well, and it's like so many different things in your field is that you may spend a little money now, but in the long range,
Right.
you're saving society money. And that's an easy sell, but sometimes it's easy to forget that.
Right, absolutely.
Let me ask you also about substance abuse, because we're seeing, am I seeing more addictions? I mean, we're looking at opioids more often. We're looking at heroin addictions. Is it getting worse? Are you seeing it getting worse, or is it just making the news now more?
I think it's probably just making the news a little bit more with the Surgeon General putting out his big report on the addictions and opioid crisis. I think that's really brought things to the forefront. And substance abuse is one of those areas that people don't like to talk about or think about, but is a definite gap in care when you have a substance abuse problem and can't get into an inpatient program or can't get transportation to an assessment or have a mental health issue on top of it, which makes it that much more difficult to access treatment. It does become a large problem for society, and a lot of those folks do end up incarcerated.
So what are we seeing as far as the recommendations from this report? What are we seeing that could be improved here in our area?
I think collaboration, coming up with some ways for all these different types of human services providers to really work together to address co-occurring needs versus sending a person to this place for substance abuse and then they have to go across town to that place for mental health. Really trying to get that so it's all inclusive for the person.
Now, how important is that, Scott? I mean, really, because when we're talking about monetary issues and we're talking about staffing, just not to duplicate services, just not to make the services you need difficult to get.
That's certainly one aspect, but think of it on the other side, Jim. Think of it as a family member, or think of it as a person who is in crisis. You don't want to have to be bouncing around. The mental health system can be very difficult to navigate. We have to look at it from a consumer's point of view and make it as seamless and as easy as possible. This is not a time that they need a complicated bureaucracy to have to bounce around. They need something easy and really treating their issues as quickly as possible.
But you're not reinventing the wheel in some ways.
So, no, we're doing things better.
Are there templates? I mean, are there models that you can emulate?
Based on what we've been hearing from the consultants that we worked with, there are a lot of best practices. First of all, our folks in the community are doing a lot of good work. And there are some best practices that we could incorporate to take that good work and make it better. And so that's kind of some of the next steps.
Well, Denise, you've seen reports issued and then they gather dust. The report just goes somewhere in a bookcase and we look at it and go, oh yeah, I remember that. Where do you want to see this go from this point forward?
So we really would like to get that community consortium together as was recommended in the report and really have kind of a neutral third party lead that charge to help agencies better work together and come up with creative solutions for really serving our population and serving them well and wrapping those services around the person.
And really make differences one-on-one, and it, like we said, it dominoes throughout this community.
Absolutely. The more dollars you spend on the front end in prevention, you save probably $100 on the back end of really costly, high-intensive services.
And Scott, we just have a few moments left, but United Way Day of Caring is next week, right?
It's May. No, it's in May.
It's
13th.
coming.
It's coming up.
2 weeks. Okay,
Yeah.
all right, thank you. Once again, a great organization that's doing great things. How important is that event each year here in the Quad Cities?
Well, we're doing two this year, so we're doing a spring one and a fall one, so that's new. And it's a great opportunity for folks to get out and do some volunteer work, helping agencies that need some things that might not get done otherwise, and kind of get your hands on and see what an agency does. It's a great opportunity to get out in the community and do some good work.
When we always think it's like somebody repainting the outside of a building, but it's also people reading books to children. It's just a whole different...
It's a lot of different things. Yeah.
All right. Scott, thank you so much.
Thank you, Jim.
Denise, appreciate
Thank
you
you.
being here. We appreciate both you. And we also want to tell you that we're getting ready to head into May and all of the great events that kick off the summer season. Laura Adams takes a tour of some great ideas you can consider before you go out and about.
This is Out and About for April 24th through 30th. Hi, I'm Laura Adams. Wings for the Future is sampling wings and beer the 27th at the Holiday Inn Hotel and Conference Center in Rock Island to help local homeless shelters. The Galesburg Community Chorus is holding their fundraiser at Buddy's Bar in Galesburg on the 26th. Humility of Mary Housing hosts their Spring Fresh Start, a benefit sale shop with a worthy cause. You'll find great bargains there, too. The 7th Annual Christian Care Trivia Night is being held at the Holiday Inn Hotel and Conference Center on the 29th. And Steve's Old Time Tap holds their Spring Chaser 5K Run Walk on April 29th. Mayfest, a German spring celebration, is being held at the historic Schuetzen Park on April 29th, or enjoy an evening of stargazing at the Bettendorf High School Planetarium on April 29th. On stage, Big Nate the Musical about Nate Wright, a detention-riddled 6th grader and garage band drummer hoping to capture the beautiful Jenny's heart on stage at Circa 21. Augustana Theater presents the musical Titanic at the Bruner Theater Center April 28th through 30th. Beauty and the Beast is presented at Davenport West High School April 28th through 30th, while the Quad City Symphony Orchestra presents a family music carnival at the River Center. UNYK, Augustana's multicultural dance ensemble, performs at Centennial Hall April 29th, and the dramedy The Tin Woman by Sean Grennan finishes its run at the Black Box Theater on April 29th. For more information, visit wqpt.org.
Thank you, Laura. This week, River Roots Live announced it would be no more. The music festival teamed up with Ribfest in August to take over Davenport's LeClaire Park for a two-day concert filled with nationally known musicians. In its place will be alternating currents, music, comedy, and other performances in different downtown venues. With changes at Blues Fest and the Bix Jazz Festival, is the era of big downtown concerts over? Joining us is the Director of Events for the Downtown Davenport Partnership, Jason Gilliland. Nice to see you, Jason.
Thanks for having me.
Is this the end of the big concerts that are along the riverfront?
I don't think so. We're still going to have Blues Fest. There's a new festival coming in called the Muddy Fest, which is a motorcycle music festival. You still have the Pops concert every year. So there's still a lot of events that are going on down on the river. And it's a beautiful place, and people enjoy going down there. And we definitely, as the partnership, support that and want to see that continue to happen.
But the partnership really is concerned about local businesses, downtown businesses, keeping the revival of downtown going. And that's
Absolutely.
kind of why you did this. Alternating Currents is kind of a shared experience, I guess.
Yeah, so I think one of the biggest differences, obviously, we're going to put it in the downtown, and we want to showcase what the downtown looks like now. And, you know, over the last 5 to 10 years, there have been some major changes. A lot of restaurants, retail outlets, bars, different entertainment venues, and we want people to come down and experience that. So with this new event, we're able to push people into those businesses and take advantage of all the amenities that the downtown has to offer.
And you're saying how many stages?
We will have about a dozen venues that we're going to be working with.
And that's amazing because, I mean, you had 2 stages, of course, for River Roots. So you're going to have a number of events going on all at one time, and it's not all just music.
Right. We're also going to have film, comedy, and visual arts. So one of the fun things about this event is that we have a lot of the doers, the creative doers in this community that are coming together with us because I love music and I love booking for the different festivals, but I don't know that much about film. I don't know that much about comedy or visual art. So we're finding the experts in those fields that are doing it here locally and bringing some of them on board with us so that they can curate that portion of the festival.
Now, you had big names at River Roots. Will you be able to get the big names now?
Yeah, so we're going to have a big headlining concert on Saturday night of the event at the Adler Theater.
Because, let's be honest, you still have the Adler as a focal point for a big concert venue.
Absolutely. So we'll be announcing that lineup here probably in the next few weeks, so we're excited about that because we do want people to come down and have that national touring experience, along with local and regional acts and up and coming acts that hopefully you can say, oh, I remember when I saw them when.
Right. And you had that with River Roots. I mean, you had some phenomenal performances, and you kind of don't want to lose that experience.
No, and this, I think, just expands upon that.
Any event organizer, outdoor event organizer, absolutely is terrified because of the weather. And you were saying, if you think about it, this is almost somewhat weatherproof.
Right. The vast majority of what we're doing is going to be indoors. And I know that, River Roots Live, part of the draw was it being outdoors. But, it's an expensive undertaking, and when you have to worry about the weather, that can kind of make or break things for you. And so this makes it lower risk in general, so that we can build this and make it bigger and better each year.
The other thing about River Roots, of course, is that you had such a wide range of performers that you just had generations out there at LeClaire Park. I mean, somebody liked some of the music at some point.
Right.
Is that kind of the whole idea now with this as well?
Yes, and we're actually going to even be able to expand on that further because, with River Roots Live, it was roots. And so all those bands that we had there had some kind of a connection to kind of roots music and Americana. But now we're able to really expand beyond that. And so we can have, electronic music, we can have rock, blues, country. We can do just about any genre we want, and we want to make sure that we have a pretty big, wide range of genres because we want a large demographic to come down and experience the event.
This idea of not having a mega event at one location but spreading the wealth, so to speak. I mean, we're seeing Daytrotter Downs, their special concert series. Sean Muller's Gas Fest was held at a couple different locations in the village. Is this kind of a trend that we're seeing? Is this something that other communities are going, this kind of works better?
Yeah, I think so. I mean, South by Southwest in Austin has been doing something similar for a long time now.
And that's the first thing I was thinking of as well.
Right, and we're not trying to be a South by Southwest. We're kind of taking the best ideas from different events and incorporating those. There's another one called Mile of Music in Appleton that is similar, but it's just music. But we take these and we like what we're seeing, that they're doing well, they're growing, and we want to do that as well. And like you said, with Gas Fest and Daytrotter Downs, that is kind of a trend right now. And we're not trying to reinvent the wheel, and we're not trying to step on anybody else's toes either. That's why we are incorporating the film, comedy, and art as well with our event, just to widen that demographic even further.
When we talked to Sean about his event, and when we talked to the guys at Daytrotter, I mean, they were trying to really point out that Davenport and the Quad Cities can still be a cutting-edge, exciting music scene city. Is that what you see, that this is also complementing that?
Absolutely. Absolutely. I think, this is just another way for us to showcase what we have here. I think it's sometimes easy to overlook some of the creative things that are happening here.
Right. Well, and let's be honest, I mean, the younger people under 25 are going to say, oh, there's nothing to do in the Quad Cities. You're trying to illustrate, hey, shut up, there is.
Absolutely, absolutely. We have lots of things for them to do, and that's part of the workforce recruitment and retention for this area. The chamber has been working on with Q2030. This is our part of that puzzle,
right.
that we're trying to fill.
Because the key is young professionals, attracting people. I mean, this is all part of a grand scheme. It's not just you're throwing a concert. I mean, the whole idea is, like you said, attracting new young people into the Quad City area as both employers and employees, and then also making sure that they're the First Army, making sure that everybody is experiencing something great in the Quad Cities. One other area, and that's RibFest. RibFest is always kind of latching on, it's kind of floating around. What's going to happen with RibFest, because that was always a part of River Roots?
And it's a very popular part. And so we didn't want to have it just go away. And so we are actually going to kind of relocate it to Street Fest during the Big 7 weekend in July. So we're going to have an entire block of Street Fest that is dedicated to RibFest.
Now, is that going to be an extension then? Another block of Street Fest?
We're kind of repurposing a little bit. Our layout is changing a little bit this year due to some construction and things like that, which is a good problem to have. So we're gonna change things up a little bit this year, and we're gonna have some barbecue vendors and some new food options, and the stage will be in a little bit different spot and those kinds of things. So it should be fun. People should come down and check it out. And I know that there's a lot of people that they really dedicate their summer to when Rib Fest is. And so we want to make sure they know that it's going to be at Street Fest.
Yeah, well, and that would be, oh my gosh, that's July then.
July 28th and 29th.
Thank you. I couldn't quite remember. Late July, yeah. So downtown Davenport's always thinking about the summer, but of course, you know, you go into the fall and the winter as well, because you really want to make that area entertaining all year long.
Yes. Yes. So we do Ice Stravaganza each year in the Freight House Farmers Market, and this year was incredible. We were able to double the number of ice sculptures we had. We had, I believe, over 60 blocks of ice that are 300 pounds a piece.
Yeah. Well, and what they do with that's just amazing.
Yes, it really is. It's a lot of fun. It's a great family event. In the middle of winter, get people out of the house, and kids are going stir crazy.
And you've been here long enough. It's just amazing to see the transformation of downtown Moline, downtown Davenport. Bettendorf is changing, and Rock Island is reinventing itself. I mean, the attractiveness of downtowns has really caught on in this area.
It has, and it's great to see, because obviously they used to be the epicenter, you know, of each city, and you know, people kind of moved away from that, and now they're coming back, and you know, those are some of the fastest growing housing markets. People want to live downtown, they want to walk around, they want to have the amenities that are available downtown, and it's great, and we want to really keep that moving.
Jason Gilliland, thanks so much for joining us. We appreciate it.
Thank you.
With the Downtown Partnership from Davenport. WQPT is also doing its part to support the military men and women in the cities who are serving our nation. We call it Embracing the Military. On Monday, Army Community Service is inviting all military members, retirees, and civilian employees to join together for the island's new coffee break program. It's being held on the first and third Monday each month on the first floor of Building 110. It's a chance to network and socialize with other spouses in the community. It's an hour-long morning coffee break. It starts at 9:30. And Cinco de Mayo is being celebrated all week on the island. The Arsenal Island Clubhouse offering tortilla soup, a taco and taco salad bar, regular soup, salad, and sandwiches Monday through Friday, all next week from 11 to 1:30. On the air, on the radio, on the web, and on your mobile device. Thanks for taking some time to join us as we talk about the issues on the cities.
Public Affairs programming on WQPT is brought to you by the Sing Group at Merrill Lynch, serving the wealth management needs of clients in the region for over 25 years.